Hello and welcome to the 2021 Virtual CHW Summit. My name is Quisha Umemba and I am the CEO and founder of Umemba Health LLC. And before I begin this presentation, I'd like to review some housekeeping items with you. This is a pre-recorded session, but the Q&A section of the Thinkific platform is being monitored to respond to any questions that you may have. You can access the discussion tab at the top right of your course player whenever you have a question to ask. The course player is where you are watching this video now. So in the top right corner, if you have a question, just click on the image of the two alternating boxes, then click Create New Post to submit your question. Keep in mind that questions will only be answered on the day that the presentation premieres live. Today's slides and any additional resources pertaining to this presentation have been made available to you inside of the Thinkific platform. You can find them by scrolling down past this video. As a reminder, we do ask that everyone complete a survey about this session. The survey is located inside of the Thinkific platform. You will be prompted to complete the survey after you click Complete and Continue at the end of this presentation. If you don't receive a prompt, you'll still be able to find the survey in the summit outline. Please also complete the summit evaluation at the completion of this week. These are extremely important and they really help me. I use every bit of feedback to inform future educational events. And just a reminder, this presentation has been approved for continuing education hours for community health workers, community health worker instructors, and certified health education specialists. But in order to obtain your certificate, you must complete the summit surveys and the summit evaluation by April 23rd. So please, please, please don't miss your window. And last, if you're on social media, please join in communicating with us. We'd love to interact with you. We're on Facebook at Virtual CHW Summit. We're on Instagram at CHW Summit, and you can see the hashtags that we're using there. Please make sure to tag us. Just let us know how you're enjoying the summit. And let's let everybody else know what's going on this week because we got a lot of great things in store for you all. That's all I have for housekeeping. Let's get on to the session now. Hope you enjoy the summit. The presentation today, we're going to be talking about the clinical integration of community health workers. We have a lot of content to get through in just a short amount of time, so we're going to go ahead and jump right into it. Hopefully you know who I am, but if not, I'm Quisha Umemba, CEO and founder of Umemba Health LLC. I'm also the co-founder of Diversity and Diabetes and the co-founder of the CHW Mentorship Network. I've been a registered nurse for almost 14 years, and I have a background in public health, as well as a couple of certifications. I am a certified diabetes care and education specialist and certified community health worker instructor. If there's anything I want you to take away from our time together today, I'd like for you to be able to understand the role that CHWs play in addressing the social determinants of health. I'd like for you to be able to describe how CHWs can be properly integrated in the clinical setting, and I'd like for you to be able to describe the 6 rights of CHW integration. Last year, I was approached by an organization that wanted me to train their medical assistants in CHW Core Competencies. And at first glance, or on first thought rather, I didn't think this was a strange request because one of the trends that I'm seeing is that CHWs, other professionals rather, are being trained as CHW. So I'm starting to see LPN, CHW, MA, CHW, or of course, like myself, RN, CHW. Well, this particular client said she wanted her CHWs trained in the her medical assistants, in the CHW competencies because it would be cheaper to train the MAs to be CHWs and pay them maybe an extra $1 than it would be to hire in a CHW and pay them at the wage that they are worth. And while I did take on the project, I also took on the opportunity to provide client education to the client on the value that CHWs bring when it comes to addressing the social determinants of health, which you can probably agree is often the true barrier to healthcare. I was able to help her to understand that it's not just a matter of cross-training another professional. CHWs have a deep understanding of their communities and the shared lived experience of the people that they serve. And that's what makes them uniquely qualified to address social and behavioral determinants of health. So you've probably heard me say it. I will continue to say it. I really do think that community health workers are social determinant of health experts. Just to make sure we are on the same page, I want to make sure I lay the foundation for the definition of the social determinants of health. So the social determinants are those factors, those drivers, or those circumstances in which people live, work, play, age, and pray. The social determinants of health are mostly what's responsible for what we know as health inequities, the fair and avoidable differences in health status seen within and between communities and different groups. And so many of the things that you see here on the screen, which actually cause these health inequities that lead to poor health outcomes, can be corrected or addressed and mitigated if someone is available to do that. And that's where CHWs really show their value and their purpose to addressing the social determinants of health. Some other quick facts. Social determinants of health primarily influence health outcomes by constraining opportunities to live a healthy lifestyle. Social determinants of health account for between 30 to 55% of health outcomes. There are vast differences in the health status of individuals and based on many different things like status, income, race, education, the area where you live. And when we talk about health risk factors, things like poor diet, inadequate exercise, and smoking are more common in groups with lower SES status. And these are the social determinants of health that CHWs are perfectly positioned to address. Now, let's talk a little bit more about why I believe that CHWs are the experts. And this is for a number of reasons, but first of all, CHWs, because they can identify with the community in which they serve, there's already this established like, know, trust factor. And so if you know anything about marketing or trying to sell anything or being, if you're trying to assert yourself as the expert or the authority in a particular topic, you have to have what's called like, know, trust factor. And CHWs have that. And it's that like, know, trust factor that really helps in their interactions with people that lead to improved health outcomes, improve health and economic equity, improve patient engagement. There's lots of evidence that concludes that CHW interventions improve health-related outcomes, especially as it relates to chronic disease management. There's evidence that really talks about how because CHWs focus on things like advancing health equity and advocating for the needs of others and marginalized populations, they're really able to help them address or access those healthcare systems that may be challenging to access due to a number of different reasons. Maybe it's socioeconomic reasons, maybe it's cultural barriers or language barriers. But this trust and rapport that CHWs have really lends to improved patient engagement, which lends to an increase in individual capacity, self-sufficiency, patient empowerment, and a more engaged and active participant in patients' healthcare. And that's why I believe that CHWs are ideal in the clinical setting. There is such strong evidence to support the integration of CHWs on clinical care teams. And this is not a new concept, right? You may be working in a healthcare system now or a clinic setting now. I don't normally see that there's an issue with hiring CHWs in a community setting as much as I see there's an issue with understanding how to incorporate a community health worker in the clinical setting. But research has really demonstrated the effectiveness of engaging CHWs to do a number of things, especially when it comes to promoting health, increasing health screenings, promoting and increasing patients in their engagement in disease management. In fact, the Community Preventative Services Task Force highly recommends interventions that engage CHWs in team-based care models to improve chronic conditions like hypertension, cardiovascular disease, diabetes, and others. So, what is team-based care or a team-based approach to addressing the social determinants of health? Team-based healthcare is the provision of health services to individuals, to families, or their communities by more than one provider. I mean, at its core, that's the definition. At least two or more providers that are working collaboratively to help the patient and their caregiver accomplish shared goals within and across different health settings to achieve high quality coordinated care. And that's the ultimate goal, is coordinated high quality patient-centered care. We know healthcare has not always been a team sport. However, it's encouraging to know that as healthcare continues to evolve, as there is more of an emphasis on prevention and being preventative and proactive as opposed to being reactive, we're now seeing where teams of clinicians and teams of healthcare providers are coming together, shifting the model to actually care for for their patients as a team with the aim of providing the best possible care. If you've heard me in any live on social media or in an interview or as a podcast guest, you've heard me say there are enough professionals taking care of the patient's medical needs. There are not nearly enough professionals taking care of the patient's needs. And I really believe this. And this is why I'm such a big proponent for having more CHWs in the clinical setting. I say let the nurses and doctors take care of the medical needs. Let the social workers and CHWs and care managers and patient navigators really help take care of some of those social needs that we know is much more detrimental or important to a patient sometimes than the medical issues themselves. So CHW interventions, especially in the clinical setting, have been shown to be cost effective, to prevent complications, to be patient-centered, and to be supportive. In fact, interventions by CHWs, because a CHW is typically a lower cost workforce than a licensed health professional, several studies have demonstrated the financial value of CHWs. And I think that's really important for a lot of organizations to understand. The skill set is so multidimensional, and you can really train, of course, keeping them within their scope of practice, but you can really train a CHW to be highly effective and serve in a really unique way in your capacity. And it usually comes by way of cost-effective interventions because they are lower cost. CHW interventions have been shown to increase the number of primary care visits that a patient has in a year, to help keep people out of the hospital, which is what we definitely want to do. We definitely want to keep people out of the hospital. And then also engaging people in their own health, activating them, motivating them to take the steps they need to prevent and delay. There's numerous studies that cite how successful CHW interventions have been and will continue to be as well. Let's look at the clinical integration of CHWs. When CHWs are integrated in a clinical setting, they work alongside the medical team, engaging in, again, that coordinated care delivery, that care coordination, and they do this with other healthcare providers. So as a member of the care delivery team, they can do things like preventive screenings, health education. They can serve as a health coach even. They can collect and provide health information to the patients and clients. They can serve as care managers or care navigators, helping clients navigate what we know is really complex health and social service systems at times. They can also do more direct care things as well, like take vital signs, measure blood pressure, do finger stick blood glucose checks, provide that medication adherence counseling for a patient that may have a low literacy level or maybe not understand the importance of their medication or the regimen for taking their medication. There's so many things that a CHW can do in the clinical setting It's just a matter of the supervisor, the organization understanding how to utilize that skill set. So within the medical home, again, the CHW can work alongside the care team. You'll normally see team-based care like a pod maybe. So maybe there's a nurse, provider, medical assistant, or maybe there's all of the people that you see here on the screen. This slide really is just an example of how a medical team can work together to provide care to their patients. And this is not an exhaustive list. This is not a singular list. You know, your organization may look a little bit different. Maybe you take out care coordinator and you put something else there. Maybe it's the front desk staff. Maybe it's a diabetes educator. Maybe it's a pharmacist. But as you can see from this particular model, the care coordinator and the CHW actually provide for more supportive care for the patients, helping to address those social needs, in addition to helping make sure that they're connected to resources, they're following up with their primary care team and addressing those medical needs as well. So again, just one example, but certainly you can see the benefit of having a CHW on the team to help address those social needs as well. Lastly, we're going to talk about the 6 rights of community health work integration. So I've kind of coined this from my nursing background. My nursing background, we have something called the 6 rights of medication administration, which means when we give medication, before we administer it, we have to make sure it's the right patient, the right medication, the right dose, the right time, the right route, and the right documentation. So I thought, why not make this also applicable to CHW integration as well, to really help organizations understand the major and what I believe the most important components of CHW integration. So the first right is the right CHW. You want your patient, you want your client, you want the leadership, the department, your partners, your stakeholders, all to be accepting and trusting of the CHWs that are hired into your organization. So it's imperative that you hire the right CHWs. Remember back to my original story when I talked about the client that wanted me to train the medical assistants to be CHWs? Because that training is a little bit different, and especially if those individuals are not representing the community, they don't look like the community, talk like or use the same language and gestures, or really understand the lived experiences of the community, that they could actually give CHWs a bad rap, right? So it's really important that as a healthcare agency, you understand the unique value that your CHWs bring to the table, and you work to protect the CHW identity. So you have to have the right CHW in place in your organization. The second right is the right training. CHWs need standardized and customized training that is specifically tailored to them and their skill set, but they also need opportunities for professional development. This is just as important. It's important for your organization to understand your scope of work. It's important also for the other members of the team to understand the scope so that those roles can be kept separate. And this is something that I commonly see when I'm working with clients, is kind of this smearing or this cross training where it's like, oh, well, the CHW's here, let them room the client, let them, do some of the more medical things, but that is not the case. So make sure that everybody understands the scope of practice for the CHW and everybody is working to that scope of practice. Remember what I say, the CHW can take care of social needs, the nurses and docs can address those clinical needs. The third right is the right tools. Ensure CHWs have the proper tools when they're providing client services. This is including the right forms for documenting client interactions. If conducting home visits, which I realize we're not doing a lot of that right now, but if they're conducting home visits, or even if they're in the clinic and they're tasked with doing things like checking blood pressure, checking blood glucose, make sure they have the equipment that they need to do that and they understand how to use that equipment. Are your CHWs documenting inpatient charts? If so, do they have laptops? Do they have access to the technology, the computers, the tablets, What else will they need to document in the EMR, electronic medical record or electronic health record? It's important to understand that in order for the CHW to do the job right, the CHW has to have the right tools. The fourth right is the right supervision and the right support. CHWs are experts in the community they represent, and their expertise must be utilized as such. However, what I'm commonly seeing is that CHW supervisors do not understand that skill set, therefore don't know how to utilize that skill set. CHW supervisors must be trained to understand how to utilize that skill set. CHW supervisors also need to be trained and aware of things like burnout and the signs of burnout, vicarious trauma and the signs of vicarious trauma. And there really needs to be organizational support, not just from the supervisor, but from higher levels within the organization, or the culture of the organization needs to make sure that there are supports in place for CHWs emotional, mental, and physical health. This is so important because of the work that they do, which usually hits close to home because they have some of the same shared lived experiences with the clients and patients they're working with. So the right supervision and support is absolutely instrumental for successfully integrating your CHW in the clinical setting. The fifth right is the right protocols and workflows for the CHW to be properly integrated into the clinic team-based care model. They have to be integrated into the daily workflow processes, and they have to understand where they fit in the clinic setting and how they work with the other members of the healthcare team. So integrate them in the workflows of the organization, train them in the clinical processes. I'm not saying train them in clinical things like dressing a wound or giving an injection, but train them so that they understand, okay, when a patient comes in for an annual wellness visit, these are the things that they need. These are the screenings that they need. So they understand I may not be doing, the timed up and go test. I may not be doing the visual acuity or whatever they're there for, but I can do the screenings. I can screen for depression. I can screen for their financial status. Are they having a hard time paying for their medications? I can screen for food insecurity and things like that. So they really need to be worked into the processes of your clinic. Also, I can't reiterate this enough, train the other staff in the work that the CHWs do. You don't want the medical assistant or the nurse or anyone else really like, well, what are they here for anyway? What do? They have a skill set. And it's really important. So all of the staff needs to know exactly what the CHW is doing and how they're contributing. And lastly, develop standardized tools for your CHWs to use with patients and care teams. So it's one thing to write them into the protocols and the workflows, but they also need those standardized tools. Maybe it's standardized templates if they're responsible for doing some type of charting and documentation in the EMR. In a lot of clinic settings, you have what's called standing orders. And so in the same way that a medical assistant or a nurse can have a standing order, there can be standing orders for your community health workers as well. And the last right is the right funding. Often CHWs are funded by grants, so you know what that means. When the funding is over, the positions are cut. I am starting to see a trend where many organizations are now creating line items in their operating budgets for CHWs, and this is so smart. I'm really excited that I'm starting to see that. I'm also seeing where there are some states that are able to authorize CHW payments through managed care programs or a combination of country, state, and federal resources. But in case you've been living under a rock, I want to make you also aware of funding opportunities that are in the pipe. This is now a perfect opportunity to seek funding for new CHW initiatives in your healthcare system, or maybe to sustain current programs or services, or maybe to partner with organizations that are doing so. But HHS, through the Centers for Disease Control, is providing $300 million to jurisdictions for community health worker services to support COVID-19 prevention and control. and another $32 million for training, technical assistance, and evaluation. So again, a great opportunity. You can find this information on whitehouse.gov. I'm sure you can visit some other websites as well. Get on some listservs so you can be notified of these funding opportunities. A great way to really invest in a professional discipline that needs investing, because we see the value of CHWs. We really need to find ways to keep them in the budget so that we can keep them helping people access resource and improve and then save lives. And then lastly, as I wrap up, I want to tell you about the Clinical Community Health Worker Program. If you did not know, Umemba Health LLC is an approved provider of community health worker certification and continuing education. The Clinical Community Health Worker Program is a core competency program consisting of 160 hours of core competency instruction. The major difference is we have a focus on clinical integration. And what does that clinical integration looks like? That's things that if you want to go work in a clinic or a healthcare system, these are things that are going to serve you well. You're going to understand or learn basic medical terminology. We're going to talk about clinic office workflows, those CHW standing orders and processes, the different types of office visits, so you can be aware of what patients need at different office visits. So an annual wellness visit versus a physical exam versus a well woman's visit, etc. We'll talk about patients' rights and responsibilities, because at your core, right, you're an educator, but you're an advocate as well. We'll also talk about health coaching and support group facilitation, chronic disease management, team-based care approaches, and more. So if you're interested, please check out the website. There's more information there. Thank you so much for your time and for your attention. I know I talked really fast, but I think that this was hopefully very good information that you can apply in your daily practices. Again, thank you for viewing. I hope you enjoy the rest of the summit. Bye-bye.